Hello, this is Capria Johnson here. I wanted to share a video of what the patient will see on their end. And so I'm assuming that the administrative assistant or whoever is responsible will be sending out an email with intake paperwork for new patients. Within that intake paperwork, one of the documents would be the animated social determinants of health screening tool paperwork as well. That's what you see attached here. So assuming that I'm a new patient, this is what I would see. I would get the typical email that I receive from your clinic with all the new paperwork that I need to complete, as well as this document here. This document says, hello, new patient family. It gives a little bit of information related to the social determinants of health screening tool. And then it has some general instructions here, also noting to the parent that it's important to have their child present because there's questions for the child and there's questions for them as well. We also note that it takes 10 minutes to complete. So as a patient, I would be going through my new paperwork, the paperwork that I need to complete before my first appointment. This would be one of the documents. And on the document, it would have the link to the screening tool. After I read this, I also have on here that you can decide not to complete this part of the paperwork at any time. After I read it, let's say that I want to complete this, I would just click on the link from this Word document. Once I click on the link, it automatically redirects me to the intro screen of the Lifescreen animated tool, which is the social determinants of health animated tool. Once I'm on this screen, I can read a little bit more information about the tool, read that it's voluntary, and then I would provide consent here to complete the tool. Just enter my name, the date is here automatically. There's a full consent document that I can view here. I can also opt to view an animated cartoon, so I can opt to see what my child will see by clicking here. If I press next, the next screen for the parent goes into just general information that we would need about the child, the parent's name, email address, and then the demographic information. And then it has social determinants of health questions for the parent. So the parent can click the answers here. Again, this should be very short. And then they click the clinic's name, which would be their provider's name. So right here, it would be my doctor's name. We could put, or a provider's name. It's a drop-down menu where they can see their doctor's name and they can choose. There's just open-ended here. They can add any additional information. They would click next. Hi there, my name is. After they click next, they're supposed to, and at the bottom it says hand the device to your child, because the next portion is for the child to complete. And as you can see here, this just also gives instructions to the child on what to do, how the questions will be. And then there's an animated person here that also explains these instructions to the child as well to make sure that there's no literacy barriers. It's Capria, and I want to tell you about the cartoon you're about to watch. So I clicked yes there so that we could move forward. And what it does, I'll be right back. I have to get dressed. After the child clicks yes, it automatically takes them to the scenes. And you see that my scene is on scene 3 because I've just completed or worked on this as well. And I ended last time on scene 2. So it's just taking me right back to scene 3. But what the child would see is scene 1. And it would go through the animation as it typically would. So it goes through the full animation and then a question pops up, they answer the question and they're just moved on to the next scene. There are 6 scenes that are about 20 seconds each. And so I'll just fast forward through this one. You can kind of get an idea of what it looks like on the patient side. I just hope nobody notices that these clothes are a little dirty. You ever not have clean clothes to wear? You ever not have clean clothes to wear? As you can see at the end of the animation, the question pops up for the child. It's actually read out loud, yes, sometimes, and no for the child as well.
Yes, sometimes, no.
The child would click on yes, sometimes, or no, save changes.
To be honest, though, I'm happy.
And it goes right to the next scene. So that continues on 2 other times until it gets to scene 6, and then it ends. So I hope that provides information in terms of what the parent and the child will see on their end.